Assalamu alaikum. I am Dr. Ejaz Mohiuddin and today's topic is pneumothorax. It is the presence of air outside the lungs within the pleural sac. Pneumo is air, thorax is thorax. It is the presence of air outside the lungs within the pleural space. Types of pneumothorax: spontaneous pneumothorax, tension pneumothorax, and surgical pneumothorax. What is spontaneous pneumothorax? In spontaneous pneumothorax, when the visceral pleura ruptures without an external traumatic or iatrogenic cause, they are divided into primary spontaneous pneumothorax and secondary spontaneous pneumothorax. Pneumothorax can also occur following trauma or iatrogenic injury such as insertion of central line. Iatrogenic is caused by the physician. Number 2 is tension pneumothorax. It occurs when there is a buildup of positive pressure ventilation within the hemothorax to the extent that the lung is completely collapsed and the diaphragm is flattened and the mediastinum is distorted and the venous return to the heart is compromised. It is an emergency. The pleural breach is inherently valve-like because the air will find its way out through the alveoli but cannot be drawn back in because the lung tissue collapses around the whole of the pleura. Patient being mechanically ventilated following trauma are at risk. Surgical emphysema or pneumonia, it is the presence of air in the tissues. It requires a breach of air containing viscous. In communication with soft tissues and the generation of positive pressure to push the air along tissue planes, the most various cause is rupture esophagus. Other causes include asthma, bulla, or positive pressure ventilation. Primary spontaneous pneumothorax, this is common because seen in young people from mid-teens to late 20s. 75% of the cases are in young men who are tall and the condition runs in families. Secondary spontaneous pneumothorax, this occurs when the visceral pleura leaks as a part of an underlying lung disease. Any disease that involves the pleura may cause pneumothorax, including tuberculosis, any degenerating disease, tumors, or any cavitatory disease. It occurs in older patients with a history of underlying lung disease such as emphysema. Clinical features: pneumothorax is an emergency. It presents with sharp pleuritic pain and breathlessness. Breathing causes severe discomfort. The mild cases are more painful, whereas severe cases are painless, because severe breathlessness, bleeding, and tension pneumothorax may occur. If the patient is not hypoxic, it is no emergency. Tension pneumothorax must be immediately relieved by inserting a cannula into the hemithorax. The risk of recurrence is increased after first episode. Indications for surgical intervention for pneumothorax: includes second ipsilateral pneumothorax, first contralateral pneumothorax. Ipsilateral means same side, contralateral means on the other side. Bilateral spontaneous pneumothorax, bilateral means on both sides. Spontaneous pneumothorax, suddenly. Pregnancy, professions at risk, examples pilots, divers, etc. Chest drain should be inserted under ultrasound guidance. It should be small bore 10 to 14 in size, usually Saldinger type. Surgical chest is in an intercostal tube in fifth intercostal space. It is always connected to underwater seal. It should be anterior to mid-axillary line, above the nipple, and below and lateral to the pectoralis major muscle. The drain is connected to the underwater seal device, which functions as one-way valve. Definitive treatment of pneumothorax: a pleurectomy. It is to strip the parietal pleura from the chest wall. Pleurodesis: here talc is used, which is insufflated into the chest cavity, called chemical pleurodesis. Normal values of arterial blood gases includes pH 7.35 to 7.45, PaCO2 4.5 to 6 kPa, 35 to 50 millimeters mercury, PO2 11 to 14 kPa or 83 to 105 millimeter mercury. Anion gap is 10 to 16 millimeter mercury. Standard bicarbonate is 22 to 28 millimeters per liter and chloride is 98 to 108 millimeter liter. Reference is short textbook of surgery, Pele and Love for teaching 26. Thank you.